So we're here with Dr. Jacqui Fleury ND, and we're discussing today, is it really menopause? Or is menopause exposing what was already there? Ladies, if you've been told it's just menopause, but your body feels like it changed overnight, this conversation is for you. Today we're asking a bigger question. Is menopause the problem, or is it revealing what's been brewing for years? Dr. Jacqui, help us with this question.
It's a great question, Genevieve. It's a great question. I think that the focus that we want to talk about today is the understanding that menopause is it's a phase of life. And when we look at the definition of menopause, it really is 1 year without a period. So it's a day in the life of a woman. But often what's happening is a lot of the symptoms that women are experiencing during this transition, during midlife, a lot of those symptoms get chalked up to menopause and kind of left at that. And now, happily, the narrative around menopause is changing, which means that more women are talking about menopause, so we feel more comfortable. We have a larger platform. There are larger opportunities to be able to talk about menopause. But at the end of the day, we're still left wondering, what do we do about this? And do we just say it's a change in hormones and leave it at that? Or do we take hormones? Is that the answer? So really what we want to understand is that by this stage of life, things have been changing, things have been evolving, and that when our estrogen actually starts to drop, this becomes an amplification of what the woman has been dealing with her whole hormonal life for sure, and even previous to her being a menstruating woman. So it's her health history all the way back to being a young girl is relevant.
Wow. That is absolutely incredible, Dr. Jacqui. I love the foundation that you've given us on menopause. I want you to really tell us how you're talking about menopause in the context of your book.
So the book it's basically me evergreened, and it became, I had the idea to write the book after having worked with women in midlife pretty much my whole career. So I graduated as a naturopathic doctor in 1998 and went into practice right at that point. And at that point, I joined to practice with two other established naturopathic doctors who were at that point the age I am now. So they were in their mid-50s.
Wow.
And I think by the nature of the women that they were working with a lot of women in midlife. And so as a young new doctor, all of a sudden, that was the population of patients that were coming to me. So I learned how to support women in midlife very early on into my career. And 25 years ago, we weren't necessarily treating menopause. We were treating women in midlife.
Yes.
And so that's where I started. And then I continued working with women of all ages, but predominantly women in midlife. And it occurred to me probably about 4 years ago, because I released the book a couple of years ago now. But it occurred to me that I was starting to see a pattern, and I was starting to see reproducible results in the women that I was working with who were really struggling with the symptoms associated with midlife. So although menopause is having its moment right now, and we're talking a lot about menopause and we're using the language of menopause, back in those days, 25 years ago, we weren't necessarily using that language, but we were definitely seeing that collection of symptoms that has remained consistent all these years. So the obvious, the hot flashes, the mood changes, the irritability, the sleep disruption, the changes in hair, the skin, how the brain is working, all of those symptoms. And then, of course, a lot of the digestive symptoms, the bloating, the weight gain, all of those changes. So those changes are consistent. It doesn't matter whether we're thinking about the women I was working with 25 years ago or now. It's just that all of those symptoms have more of a voice. We have a larger platform that we're talking about those symptoms now. So I realized several years ago that I was seeing really consistent results in the women that I was working with who were struggling with the menopausal collection of symptoms, but I wasn't treating menopause. I was treating the woman who had this collection of symptoms, and realizing that without the use of hormones, and we'll get into that in a moment, why I wasn't using hormones, but without the use of hormones, I was getting 80 to 90% improvement in, I would say, 90% of the women that I was working with. And I realized I had already written one book, and I realized this was my second book. And this would be my legacy to the world of women's health, because I had spent so many years and I'd sat with so many women, thousands of women over the years, who were really, who they didn't have any other tools to really cope with what they were going through. And hormones at that point just weren't an option for these women. So I had to get very good very early on in using the tools that I was trained in. And we'll talk a little bit about that root cause medicine. But I had to get very good at using the tools of treating the woman, not the symptom, because every woman is unique.
Right. Dr. Jacqui, thank you for that explanation. And I'm asking questions. These are questions that relate directly back to your book. So it has a lot deeper explanation for a woman who wants to pick up your book and have it as a resource. And one thing that I said to before we started today was, like you mentioned, there is a massive narrative around menopause. And I mentioned that there's a disconnect. And what I like that you bring is that connectivity. I really think when you talk about menopause, every single woman, whoever she is, can relate, because you have done the research, you have worked in this industry, and you delineate that wisdom and knowledge in such a way that we really think, oh my goodness, I've tried everything. Dr. Jacqui Fleury ND understands me. Now, how do I get some help through your wisdom and knowledge? So thank you again for this book. And you mentioned something that is really great. Well, everything you mentioned is really great. Let's just be clear. I wanted actually to jump ahead and ask something that you said about root cause. So can you explain the root cause revelation in the way you use it with patients?
So the root cause revelation, it's a term that I came up with. It's kind of unique to me, but really I want you to think about your body. I want you to draw the image of a tree in your mind, and you are the trunk of the tree.
I'm thinking, ladies, make sure you're doing it.
You are the trunk,
Yes.
and then the branches and the leaves are all of the symptoms that you can list that are related to your life going through midlife. So all the hot flashes, the brain fog, the fatigue, the vaginal dryness, the urinary incontinence, the bone density issues, you name every symptom that you can list that is being associated with menopause. And then I want you to visualize the roots on the tree. And the roots are where we do the best work to help address all of the leaves on that tree. So the root cause revelation is the work that I do at the base, That's the foundation. That's where we're going to get the best leverage and where we're going to get, I guess, the biggest bang for our buck if we really want to be practical about it, because for every leaf on that tree, that's a symptom. So whether that is brain fog or whether that is hair changes or skin changes or vaginal dryness or gas and bloating, you name it, every single leaf on that tree can be, we can connect that back to the roots on that tree.
Right.
And then what's laying at the roots is going to be the foundation. So it's going to be your digestion, your absorption, your elimination. That's going to be key. And then from there's more at the foundation, but that's a really big piece of the work that I do.
Wow. Now, ladies, when Dr. Jacqui said to visualize yourself as a tree, I did that. So make sure you're doing this because it really is helping you connect with her decades of wisdom as to how she helped us traverse this area. And by the way, she's helping me traverse it. And I really visualized what you were talking about, a root cause, foundational things that we have to change. And that's what makes you so unique, Dr. Jacqui, with the relatability to all of us girls who, and by the way, I'm sure we'll talk about the perimenopause stage. So ladies, it's for you coming up to this stage, and when you're in the stage and post, you help us foundationally across the board. That is an amazing coined term, root cause revelation. Dr. Jacqui Fleury ND. She helps us get to the foundation of what really causes those menopausal symptoms. Now, another question. Why does menopause seem to hit so hard in the middle of career, caregiving, and family pressure?
Mm-hmm. Well, timing is everything. And so I think that when we're hitting midlife, so we're in our 40s and 50s, of course, our kids are getting at a stage of life where there's a lot of transitions going on for them. We also may be caring for our parents that are struggling with health challenges, and we might just be at the height of our career because we may have spent the last 20, 25 years like really climbing the corporate ladder or at a really successful place in our business. So all of a sudden, when our hormones start to change, everything just feels amplified. And when we have estrogen as a buffer, then we can kind of take on the world. Like we really feel like we can tackle the world. And we might notice that even when we're perimenopause or even prior to our hormone shifting at all, we may notice that the first half of our cycle, we feel like we can take on the world. And then we ovulate and then our hormones shift. And then all of a sudden now the slightest disruption in our day can leave us in tears. So we see that on a monthly basis as well, but then that just gets amplified when we hit menopause because the estrogen drops like quite significantly, but it's not just transitory. Now now this is dropping for good.
Wow.
And so that is where the amplification, we don't find that we cope as well with a lot of things in the same way that we did when we had the buffer of estrogen.
Right.
On a monthly basis.
Thank you, Dr. Jacqui. That makes so much sense. And again, with your experience and your decades of working with this group, us girls, figuring it out, seeing all the different ways in which, this change of life affects us, that makes absolute sense when you talk about us caregiving with the adult children. There's so many amplified stressors, and then we don't have estrogen as a buffer. I know you're going to help us. I know you're going to help us, Dr. Jacqui. Another question. What have your patient stories taught you that lab work often misses? And I'll do a little bit of a transition here. Of course, now when we started talking about this, talking about your book, talking about menopause, and it's just not, menopause didn't just show up. A lot of what we're hearing is about, of course, getting labs, and that's very, very important. However, what I've heard you say, when you come to that root cause revelation, Dr. Jacqui Fleury ND, it's a much bigger picture. And so, again, back to that specific question, you hear your patient's stories. What is often missed on a lab work versus what's going on with the patient herself?
It's a great question. And I think I'll just clarify, there is value to knowing your labs for
Yes,
sure.
of course.
Unfortunately, I think what is generally run for lab work doesn't necessarily identify what is actually shifting for the woman in terms of like what's going on at the level of her cell membranes, what's going on in her gut. And so if you just run standard CBC and you do definitely liver enzymes and kidney function, cholesterol, all of those are valuable lab markers to know and definitely important to track. But it still doesn't necessarily tell us what to do. So even if we do see something out of balance, like let's say the cholesterol has climbed up a little bit, or which is very common in menopause and perimenopause, we'll see a slight bump in the LDL cholesterol. But then it doesn't necessarily give the woman any practical tools. Like, okay, I know this information now. What do I do about it? And so that's why so I've written 2 books, and they're both practical guides. So they're not all encompassing bodies of work in the sense that every detail you need to know about menopause is not written in my books. What is found in the book are the practical takeaway tools that you can implement, that you can really focus on, because there's a ton of information out there. But at the end of the day, where do you start?
Absolutely.
Like, what are your starting points? And in particular, when most women they don't feel like themselves. They say that over and over again, I just don't feel like myself. And a lot of that is rooted in the way their gut feels, like their digestion. A lot of it is in the way their clothes fit, in the way their skin feels tight and dry and itchy. And so really women are wanting to know, where do I start with all of these symptoms?
Absolutely. Very, very well explained. You know, Dr. Jacqui, your explanations are not explanations. They are real life, what you have seen, again, from numerous thousands of patients over your time, really helping us with this. Now, you talk about your 2 books. I think it's important to verbalize it for those ladies who are listening. And then I would be honored if you had a copy of it to also hold it up if we're watching.
Yeah.
So
for sure.
Please tell me what the 2 books are. And I love what you said about them being practical guides.
Yes.
So if we can actually just take a moment to talk about your books, however you want to talk about them, either the second going backwards, and why you decided to write it in such a way where it wasn't just, more information, but it was a practical guide.
Yes. So I'm smiling when you ask that question, because the first book is called Master Your Moods. It's Not All in Your Head. And this is a very practical guide. You can see how thin it is.
Yes.
And that book I wrote several years ago after I was seeing that connection between the work that I was doing in terms of the root cause foundation, the root cause revelation, which was when you treat the gut, then a lot of the other symptoms that a person may be dealing with, whether that's brain fog or fatigue or sleep disturbances, even in terms of moods, so symptoms of feeling anxious or low mood, like depressed, a lot of that improved just from doing the work that I would do in the gut. And so I had that awareness, that was 2018, and I thought I should write a book, because people need to know this information, that what's going on in their thoughts and in their brain and in their energy and in their moods may not be just going on in their head. And so that's why I called it Master Your Moods. It's not all in your head, because it's rooted in other places.
Excellent.
So that was my first book. And the best compliment I would get when people would grab a copy of my book is they would say, "I read your book cover to cover." And that's a really big compliment because I think a lot of people start a book and they never finish it.
Very true.
Or they get into it, or they've got 2 or 3 books on the go,
Yes.
and they get 3/4 in, or if they're lucky enough to finish it, then they go back and they think, okay, now what?
Exactly.
So that was a lot of great information, but then
Yes.
what do I do with it, right?
Yes.
And so it's a practical guide. It's got
Love
like
it.
shopping lists. It's got, and again, that was back in 2018, but people are they're still using the book. I have clients who would say to me for years, up until I wrote my second book, that they read it cover to cover. And really it's like having me in your back pocket. And so,
Amazing.
especially for clients who've worked with me for years, I find myself saying the same thing over and over again.
Yes.
And not because the person doesn't listen or pay attention. It's because the average person, like, we can only retain so much information at any given point. And so it gives you the ability to go back and hear my voice again and again. And it was the same thing with the second book, which is Master Your Moods for Menopause and Perimenopause,
Great.
because it's a little bit thicker. So when this one arrived in the mail, because as an author, when you see, when the book finally arrives and it's the first time you've held it in your hand, it's like a newborn baby. But
Yes,
I looked at it and
exactly.
the first thing I said was, wow, it's a little bit thicker. I hope we can get through it. Because again, there's no shortage of information, especially nowadays, right? And especially with AI. So you can self-diagnose yourself on AI. We don't necessarily need to talk to somebody about what's going on. However, the flip side of that is I think we absolutely do need to talk to somebody about it.
I'm glad you said that.
Yes.
Yes.
So the book is me. It's me evergreen, and it's thousands of stories, and it's insight. There aren't a thousand stories in the book, but it's written after hearing thousands of women's stories over the years and seeing a consistent pattern, a consistent theme in the lives of so many women, and then being able to distill those themes down into practical takeaways so that it doesn't matter where you are on the continuum of your women's health journey. You need to understand what are the foundational, what are the bare bone basic things that I can focus on. Because of course we know that if we don't feel like ourselves and we're fatigued and we're not coping in life the same way. So you listed the transition, like having kids and having aging parents and trying to keep your career together and be in relationship. So the last thing we need is more information that we can't figure out how to apply to ourselves. So that's why I wrote the book, because I want women to at least have a great starting point, have some foundational tools, focus on what you have control over. And then I'm certainly happy to point you towards all the other really great books and resources and voices in menopause right now. But for the average woman, it's a lot.
It's a lot.
It's a lot.
It's a lot. You explained how your practical guide is different from more information because it's already a lot. Like you said, we don't need more information. We need a way to get through this stage and phase, which brings me to this question. If this episode, because we're actually gonna take ladies and the gentlemen who love them on a journey through your books, with us having these conversations. And so in this first introductory part of your books, what would be, and I know this is hard, if there was one practical guide point that you could give to any woman that's listening, whether it's a quick social media clip or your full video, what's one practical point that you would say to women in general that's a great takeaway from the introduction to your books?
I would say, there were a couple of thoughts I had as you were formulating that question. I would say the first one may or may not be in the first chapter of the book, but it is trusting your own inner voice.
Oh, wow.
And I don't think that is in the first chapter. It is, I think it's in the last chapter, actually.
Yeah.
But that's what I was thinking of as you were formulating the question, because we are inundated with information and a lot of expert advice, but nobody knows you. Nobody knows you. Nobody knows your body the way you know your body. And when you take the opportunity to really listen, I think you become the guide. You become your own health guide, and then you build a team around you. But just always believing your truth, like what is actually true for you. And then probably that what is found in the first chapter is understanding that menopause is not the problem. Menopause is an amplification of what's been going on for you for many, many years leading into the final chapter of your estrogen.
Right.
And that it's just an amplification. It's just it's time and space.
Right.
And not to just blame it on menopause and then look for a treatment for menopause. It's so much more than that.
Wow. Dr. Jacqui Fleury ND, ladies, we're talking to her today about her books on menopause. And it's incredible that you gave us those practical takeaway, because that's for each and every woman and their families, the men who love them when you're going through this stage. That is so well said. And I am of that age. And when you talk, you're talking to me.
Mhm.
But I know you're talking to all my other
Yeah.
sisters out there. Thank you so much. This is just the beginning. It's the beginning of the incredible practicalities that's in your book to help us ladies traverse this stage. Thank you for what you do, Dr. Jacqui. And we're coming back with more root cause, all that you've collected over your decades of experience, and now breaking that down as your legacy. I love that you said that, as your legacy to us girls to get through this phase. Thank you, Dr. Jacqui.
Thank you, Genevieve.